The issue of health care is on everybody's radar right now, but the details are even more important for anybody who's eligible to retire this year. When should you apply for coverage? What does it cover? And what if you're still working past the age of 65? In today's Your Money, Better's finance and career expert Maribel Aber says the program that serves over 42 million people varies from state to state, and you need to know about some important changes. Medicare was enacted in 1965 as a federal program that pays for certain health care expenses for people 65 and older and the disabled.
There's a lot going on with Medicare right now. Different deadlines, things that people should be aware of because they're not aware of the adverse consequences that could happen if they don't file timely. I mean, Merrill Lynch had just put out some reports saying that more baby boomers were staying employed, so they're working now and they're saving for their retirement because they need to recoup those losses. So you think, hey, I've got a health care plan, I'm still working. Should I just stick with it and not apply for Medicare? Well, the answer is it's a little bit more complicated than that.
So make sure you file on time to avoid those consequences. More on that in just a moment.
And it has 4 parts. There's a part A, B, C, and D. And I'd like to spend some moments really focusing on part A and B because I think that's what's most confusing to people right now. Well, part A really focuses on hospital expenses. So we're talking about, in-hospital patient care, hospice care. It covers services like anesthesia, chemotherapy. But the thing here is you really want to focus on what is covered in your plan. And I would say look to Medicare.gov because it changes from state to state. Well, for Part A, if you're receiving Social Security benefits, you're automatically enrolled in Part A and Part B, okay? But the initial enrollment period is actually a 7-month clock. People don't know this. It starts 3 months prior to your 65th birthday month, okay? And it ends 3 months after that. So if your birthday's September, then it ends for you in December. And if you miss that deadline, you've got to wait until January of the next year, and it runs to like March 31st. And if you file during that time frame, your coverage is not effective until July 1st.
As for the cost of Part A, Maribel says it's free if you're 65 and you and your spouse worked and paid Medicare taxes for more than 10 years. But if you paid Medicare taxes for less than 10 years, you'll have to pay a monthly fee, and that amount can vary. Now for Part B.
Part B really focuses on doctor's expenses, okay? So for most expenses, Part B will cover 80% of the expenses and you pay the remaining 20%. Now it's the same enrollment, initial enrollment as Part A, the 7-month clock I was talking about, but here's the change or difference. There's a special enrollment period for people who are leaving their job, okay? So let's say you're leaving your job, even if you're terminated or you're voluntarily leaving, you have 8 months from the date that you leave your company to file for Medicare Part B, all right? That's so important because if you miss that deadline, what happens? You gotta wait till the next year, the January to March 31st timeframe, and then you may also be subject to, worse than that, a late penalty enrollment.
The most common pitfall retirees should be aware of is not checking your company's health plan to see if you're required to sign up for Medicare Part B when you turn 65. And if you're age 65 and leaving your job?
A lot of times people want to extend their health care coverage through something called COBRA. Now, 1, you're subject to the 8-month special enrollment period. People forget about that. And 2, a lot of times what you've purchased in that COBRA is really only providing you supplementary coverage.
Good to know. Well, we realize there's a lot to be aware of when it comes to Medicare, so if you have any questions, you can always email Maribel. Her email address is askmaribel@bettertv.com.